Maybe you too have felt some strange and unusual symptoms, but you told yourself that these symptoms aren't dangerous and will go away after a while. There's a very important point you need to pay attention to. It's that some symptoms which you might think aren't particularly important can actually be signs of a dangerous disease. Not all illnesses have clear and obvious symptoms. Some conditions have hidden signs. Therefore, as soon as you notice any change in your health, you should immediately see a doctor. Hello, welcome to the Dr. Code YouTube channel. I'm Mohammed Zari. I am a lecturer in internal surgical diseases from Shahid Beheshti University of Medical Sciences in Tehran. In this video, I intend to introduce you to the hidden symptoms of diseases. Stay with me as we continue. The first sign, you forget people's names. Have you ever completely forgotten your co-worker's or neighbor's name? Forgetting other people's names occasionally is normal, especially if you're sleep deprived or under a lot of stress. But if you regularly struggle to remember the names of people, or often find that you cannot quite recall certain words while you are speaking, you might be experiencing a condition called hypothyroidism. The second sign, you sweat more than usual. For example, you might sweat during a stressful work meeting, or when doing high-intensity workouts or giving a presentation in front of a large audience. Sweating is normal, but if you sweat in other ordinary, non-stressful situations as well, or if you unexpectedly begin to experience excessive sweating, the underlying cause could be hypothyroidism, which is a hereditary medical condition and can lead to persistent excessive stimulation in the soles of your feet, hands, face, and underarms. The third sign to watch for, you notice small distinct red or white spots appearing under your fingernails. If you see these spots appearing under your fingernails for no apparent reason, you might be suffering from a condition called systemic lupus erythematosus, which is an autoimmune disease that can cause blood clots and joint pain. There is also a possibility that you may have developed nail psoriasis. The fourth case is when your complexion is pale and lifeless, if your skin suddenly becomes paler than usual. This could be a sign of reduced blood flow in your body, causing your skin to look paler and more drained. It may also mean that the production of red blood cells has significantly decreased. If this issue is accompanied by dizziness and unexplained fatigue, you might be suffering from anemia. The fifth case involves a noticeable change in your handwriting. If you have recently started writing in a messy fashion, or if your writing is much smaller than it used to be, this issue could be an early sign of Parkinson's disease. The sixth case occurs if you have recently started snoring frequently. Occasional snoring can actually be due to allergies or a common cold, but if you snore every single night, you might be experiencing significant swelling of the tonsils or a deviated nasal septum. If nighttime snoring is accompanied by other symptoms like high blood pressure, chest pain, or difficulty concentrating, you are probably suffering from sleep apnea. Seventh case, you urinate more than usual. If you are drinking more water or fluids than before and your urination frequency has increased, this is completely normal. But if you feel like you are urinating more often for no apparent reason, it's likely that your bladder or kidneys have a problem. This could also indicate a urinary tract infection, a sexually transmitted disease, or diabetes. The eighth case, you regularly experience frequent heartburn. Heartburn is a painful and uncomfortable burning sensation in the throat or chest that is triggered and caused by excessive stomach acid. This condition can frequently develop after eating spicy foods or consuming alcohol. Obesity, smoking, or an inactive lifestyle are also associated with heartburn. Ninth case, do you experience redness or a rash on your cheeks? If you notice a butterfly-shaped redness on your cheeks and don't know the cause, this issue could be a sign of a serious condition. Rashes are usually accompanied by pain and itching. However, it can also be a sign of lupus erythematosus, which is a complex autoimmune disease. 10th case, experiencing severe numbness. Numbness can indicate that you have been sitting for too long. But if you feel tingling or pins and needles on one side of your body or face, or in your arms or legs, you might be having a stroke. Therefore, the best thing you can do is to seek immediate medical attention. In addition to numbness, you may also experience sudden confusion, blurred vision, or difficulty speaking. If you feel that your numbness is not due to a stroke, it's probably caused by other disorders such as Graves' disease or related complications, or by diabetes. If you have stroke symptoms or are about to have a stroke, call 115 immediately. The 11th case, without intending to, you experience rapid weight loss suddenly and without any changes in your diet, or if your regular exercise routine has caused you to lose more than 4.5 kilograms, you should see a doctor to determine the cause. The 12th case, you notice that your mole has changed. A change in the appearance of a mole could be a sign of skin cancer, such as melanoma or squamous cell carcinoma. The 13th case, you constantly feel thirsty. If you notice that you're getting much thirstier than usual, this could be related to changes in your diet or exercise routine. Exercising more, changes in the weather, or eating more salty foods can all make you feel thirstier. But if your increased thirst isn't due to any of these reasons, the cause could be diabetes. Excessive thirst can also be a side effect of certain prescribed medications, and it can also occur during a period of pregnancy. The 14th case, the skin on your palms has become quite rough and thick. Rough and thickened palms can indicate that a malignant tumor is growing inside the body. The 15th case, you always feel very sad. If you sleep 8 hours at night but still feel like you need to sleep more than 8 hours, you probably need to make some changes in your lifestyle, like eating healthier food and exercising. If you feel like you're actually healthy, your drowsiness could be a sign of a new health problem. Number 16, experiencing severe pimples and acne. If you've recently changed your facial cleansing products or you're on your period, getting a few pimples is normal. But if you never used to get pimples before and now you're experiencing severe acne, you should take it seriously. This can also happen when entering menopause. Number 17, experiencing persistent coughs. If you develop a persistent cough that isn't actually due to a cold or the flu, the cause could be concerning. If you smoke, you likely experience a cough, but otherwise, a cough could be an indicator of a health issue like lung cancer or a lung infection. 18th, your skin has become dry and cracked. In the cold winter, it's normal for most people to have dry skin. But persistently dry and cracked skin can be a sign of a fungal infection, like athlete's foot. You might also be experiencing eczema or other types of dermatitis. 19th, have you suddenly started having trouble solving simple math problems? A sudden inability to do basic arithmetic that you once found easy. This could mean that you are in the early stages of Alzheimer's disease. When this disease begins to progress, the cortex of the brain is affected. The 20th sign is dizziness. Dizziness can be described as the sensation that the room is spinning or a feeling of imbalance. It can be described as a loss of balance. If you occasionally feel dizzy when you suddenly stand up, you are probably dealing with issues like persistently low blood pressure or low blood sugar. But if you are suffering from a chronic illness, the underlying cause may require urgent medical investigation. Sign number 21. If you notice distinctive white rings around the cornea of your eyes, the appearance of these white rings is a medical condition called arcus senilis. If you are over 30 years old, this condition is not normal. But if you are below the age of 30 and you see these white-colored rings around your cornea, you should see an eye care specialist, so they can check your blood cholesterol levels and thoroughly identify any other underlying conditions. Case 22. Experiencing excessive hair growth or severe hair loss. In most cases, hormonal imbalance in women leads to excessive hair growth, while in men it causes hair loss. If you notice severe hair loss or excessive hair growth, you should see a doctor to find out the cause. Case 23. Gaining weight only around your waist. Excess weight around the abdomen can be due to various reasons, as a result of different factors, including an unhealthy diet, lack of exercise, stress, aging, or genetics. Visceral fat is the most dangerous type of fat because it surrounds vital organs like the liver and lungs. Even if you don't have fat in any other part of your body, abdominal fat can be extremely unhealthy and dangerous. Case 24. Swelling. If your foot or knee is swollen, most likely the cause of this condition is poor blood circulation. This means your blood vessels are becoming weak, or there may be a blood clot in the vessels. If this condition is not treated, it can be dangerous and lead to stroke or heart-related complications. Case 25. You have chest pain. Chest pain, it can have various causes, including severe heartburn or even COVID-19. Do not ignore this pain, and if you experience it, call 115 immediately. Case 26. Your teeth have become extremely sensitive. As we get older, the enamel on our teeth becomes weaker, and our teeth become more sensitive to cold and hot foods. If you notice that the enamel on the back of your teeth is rapidly weakening, this could be a sign of acid reflux from the stomach. Case 27. Your gums. There is a connection between the bacteria that cause gum disease and the bacteria that cause heart disease. There is a link. Even if your gums are damaged just a little bit, bacteria enter the bloodstream and from there can reach anywhere in the body, causing inflammation throughout the body. Case 28. If you notice blood in your urine, seeing swelling around the area can be concerning and may indicate the presence of a serious condition. It could be a dangerous disease. You might have a bladder infection, kidney stones, or kidney disease. This issue could also be a sign of bladder cancer or the presence of a benign tumor in the bladder or kidney. Case 29. Do you have a rash on your skin? A blistering and itchy rash may seem like a simple allergic reaction or eczema. However, in some cases, a rash may indicate celiac disease. This autoimmune disease is essentially the digestive system's reaction to gluten. Case 30. Experiencing stabbing pain. Severe back pain. If you suddenly feel intense pain in your back that is not related to an injury or is not associated with trauma, this could indicate an aortic rupture. This complication occurs when an aneurysm develops in the aorta and one or more layers of the artery wall tear. If you experience shooting back pain for 20 minutes that is not accompanied by any other symptoms, go to the emergency room immediately. Case 31. Seeing blood in your stool. Seeing blood in your stool could indicate a flare-up of an inflammatory bowel disease such as Crohn's or ulcerative colitis. If you have recently consumed beets, red-colored beverages, or red gelatin, your stool may appear red and you shouldn't mistake this for blood. Sometimes the stool takes on a tar-like appearance, and if you don't see a gastroenterologist promptly, you could lose your life due to bleeding. Thank you for staying with me until the end of the video. If you have any questions, leave a comment and I'll personally respond. Take care.